I wonder if I'm actually live. Oh, I had to actually see. Let me see. Oh, I am live. I've never done this before. Um, for anybody tuning in to the session, I just had some thoughts that came to my mind, um, and I wanted to go live. And I've never actually gone live before, but I wanted to put this in this format just to kind of get it off my chest, um, so that later on I can maybe edit it or post it on another platform. But the title of this video says, "Do women draw the short end of the stick?" And the reason that I decided to post this topic or to talk about this is like I wanted to share my perspective as a healthcare professional on what I've seen in healthcare. Just briefly, nothing like long or anything, but I'll give some different examples and experiences on things that I've seen. So maybe this will be in some enlightenment for specifically, I think I'm talking towards men because I think women already know, a lot of women already are aware and know this, but men, I think sometimes don't. And I like to share my perspective as a male in healthcare and my observations. Um, so, one of the things that many of you don't know, when I used to work at a rural kind of semi-community hospital up in Tennessee, there was a situation that happened where this mother ended up giving birth. She had a slow progressing labor. There was a complication where I guess the baby got stuck in the birth canal, and I don't know if the doula or the husband knew the appropriate interventions to allow it to open up the pelvis and allow the baby to come out, but the baby ended up like asphyxiating and suffering like I think an internal decapitation, which is pretty much where like the spinal cord and all that kind of and the blood vessels and all that, I guess, rupture or whatever, and caused the baby to pretty much be decapitated and lose blood flow to the brain. And the baby ended up like having lack of oxygen and all these things, and ended up arresting and came to the hospital where I was working. And I'll never forget, they were like, "Yeah, we have CPR in progress with this infant coming in." I was like, "An infant? It's crazy." And the mother, it was two patients, not just one, because anytime you have like maternal issues, you have the mother and you have the baby. And of course, as a father of five, I've been in many situations of, giving, seeing my wife give birth and things of that nature. Um, but this woman came in. Well, first was the baby and then the mother. And of course, we worked on the baby. I don't think we weren't able to save the baby, but it just showed the reality of women and childbirth and what happens and the severity of it and how severe it can be. Now, of course, that was like a off situation because it was like in the rural area. There was a lack of access to health care and all these things. But the statistics show that delivering children can be potentially dangerous for women. And sometimes I think like men don't understand that like women put their lives on the risk, put their lives at risk to birth children, and the levels of severity that they can go to, because obviously the mother has to now deal with the mom eventually came in and she went straight to labor and delivery, and they ended up working on her, and I think the whole mass transfusion protocol, pumping full of blood, postpartum hemorrhage and all this stuff, but this stuff can be life threatening. But the reason I'm bringing this up is because me and my wife, occasionally we talk about how women draw the short end of the stick in life sometimes. Um, and I think what she means by that and what I understand by that really is that, you know, not only with that situation with the woman giving birth and the baby ended up losing their life and then the woman almost lost her life. I think she actually was able to survive. But even in situations like that with childbirth, that's an extreme situation. But then you have situations where I work in the ER and you have young women come in and they're getting checked for STDs. And, a lot of the times the partner isn't there. So you have this woman who's symptomatic and they come in because things don't feel right down there. And then the male partner is like either unaware or refuses to get checked or is just kind of like too busy to really accompany and assist the woman whom they have relations with to come and assist or to stand by them in the ER. So these women come to the ER because usually they suffer more symptoms. A lot of men are asymptomatic when they carry sexually transmitted diseases, or if they even have UTIs, a lot of men are like asymptomatic. So these, the women end up coming in a lot more, and for urinary tract infections and STD checks, and et cetera, et cetera. And looking in a lot of these women that I take care of are young, and just seeing them come in the ER, they're unaccompanied by this male partner, and they're alone, and they have to deal with the realities of what has happened. Or sometimes it's not just young single women, it's married women, that have these issues going on, and of course the partner isn't there, the husband, unaware of what is going on, or if they're maybe communicating but they're not physically present for whatever reason, or even if they are present, sometimes they don't understand the severity of like women and their pH balance, and how marital relations can change that and affect that and cause such I don't know the word, a dysregulation of that area, and end up causing these women to suffer. Um, Women, obviously, we all know women suffer from, like, well, not suffer, but there's a 28-day cycle, a menstrual cycle, and some of these women end up having like fibroids or ovarian cysts, and a lot of them come in the ER from menstrual bleeding, and like heavy bleeding, and a lot of them have to end up getting blood transfusions. Some of them suffer from iron deficiency, anemia, and all these things. Um, a lot of them have to end up getting admitted to the hospital, and it's like this whole thing. We're just talking about women, and you know, a lot of the times I look at them and they just look so like discouraged sometimes, fed up, angry, upset, and I can't speak for all men, but a lot of the observations that I see in the hospital sometimes is just like the men are just completely unaware. Um, don't really don't have an understanding of female anatomy, of the menstrual cycle, and female physiology, even with birth and pregnancy, understanding how that changes the women's physiology. Um, so yeah, it's a lot that goes into it, and I'm just coming on to just kind of share my experiences where you have, um, even on the side of when I say draw the short end of a stick, oftentimes because of our culture, women, they are more like the caretakers, and a lot of men end up getting sick, coming to the hospital in the emergency room, even in inpatient because I work inpatient, and a lot of the times, women are the ones, assisting, making healthcare decisions. They're usually a lot more healthcare literate because they go to their outpatient appointments. They follow up with the physicians. They follow up on their appointment. They get their blood work. They're just, it seems like more responsible in that area as far as health. And a lot of the men seem kind of almost incompetent, or not incompetent, but just kind of illiterate when it comes to healthcare. And they rely on their wives for a lot of support, as far as medical information and knowledge, to the point where a lot of men don't really know like what medicines they're on, and they lean and heavily depend on the women, and that's like one more emotional burden and load, mental load that they have to carry as women, on top of like all the other things that I just named. And I'm strictly speaking from just a healthcare perspective, right? Of like working in the ER, working in the ICU, working in progressive care, and all these different areas. And I could just go on and on and on about this. So really, the point of the video is really just not only bringing awareness to how much women, you know, I don't want to say suffer, but how much women have to endure in this lifetime, with some of the things that they have to go through, but also just making men more aware, for those men who are watching this, who see this, who may share this little small brief video. It's just um, a reminder, that when you see your mom, when you see your aunt, your wife, your sister, your cousin, that's a female, a woman, of age, of menstruating age and all that, or a woman who's had multiple children, or even a grandmother who's enduring menopause. Because, menopause is its own topic, and there's a lot of women who suffer from hormonal things later in life, and that's its own, like a lot of men don't really, we don't get pregnant. We don't have to stop working when the babies come, so paternity leave is a real thing now, but that's, that's a newer thing. But men typically don't have to stop working when we have children. Men don't have to go through menopause and et cetera, et cetera. So just having, you know, looking at the women in your life and kind of remembering those things, um, and remembering that, like, the sacrifice, really that they have to, especially during childbirth, and then just like having more compassion and empathy upon the women in your life when, because they do have a lot more areas that physiologically, biologically, that they have to endure compared to us, their male counterparts. So I'm just gonna end the video there, but this was on my heart and mind tonight. And instead of like making a whole video and chopping it up and editing it and all this stuff, I'm just going live and I'm gonna share it on my platform. So, anyways, I hope somebody learned something from this, or at least, it's just a reminder for those who already know about this kind of stuff. Like, hey, let me be more mindful of stuff like that when it comes to the women in my life, um, and take on or the initiative to learn more about healthcare and to be a little bit more involved in the medical part of um, the women in my life, if they allow it, if they want it, or whatever. But yeah, all right. Thank y'all for tuning in. Whoever's watching this.